Port placement. Frequently asked questions. Expert answers from Dr. Bilal Anwer at the Leg Pain Clinic. What is a port? A port, or Port-a-Cath, is a small medical device placed under the skin, typically in the chest. It's connected to a catheter that enters a large vein and provides easy, long-term access to your bloodstream for treatments like chemotherapy, IV medications, or frequent blood draws. Why do I need a port? Ports are commonly recommended if you are receiving chemotherapy or long-term IV therapy, need frequent blood draws or transfusions, have poor vein access in your arms or hands, need IV nutrition, TPN. A port reduces the need for repeated needle sticks and helps protect your veins over time. How is the port placed? At the Leg Pain Clinic, Dr. Bilal Anwer places ports using ultrasound and fluoroscopic X-ray guidance. Here's what to expect. A small incision is made to insert the port under your skin. The catheter is threaded into a large vein, usually the jugular vein. The entire procedure takes less than an hour and is done with local anesthesia and mild sedation. You'll go home the same day. Will it hurt? The procedure is typically well tolerated. You'll receive local numbing medicine and light sedation to help you relax. Afterward, you may feel sore for a few days, but most patients resume normal activities quickly. How soon can the port be used? The port can often be used within 24 to 48 hours, depending on your doctor's instructions. Some ports are even usable the same day if needed urgently. How is the port used? A specially trained nurse will access the port using a small needle. Once accessed, the port can be used to administer IV medications or fluids, draw blood for lab tests, give contrast for imaging studies. When not in use, the port sits under the skin and is not visible, except for a small bump. How do I take care of my port? Keep the incision clean and dry during the first week. Once healed, ports are low maintenance. If not in frequent use, it should be flushed every 4 to 6 weeks to prevent clotting. Avoid heavy lifting or vigorous arm movement right after placement. How long can the port stay in? Ports are designed to stay in place for months or even years, depending on your treatment. Your doctor will remove it when it's no longer needed. Are there risks? Port placement is very safe, especially when done by an experienced interventional radiologist. Rare risks include minor bleeding or bruising, infection at the insertion site, catheter-related issues like blockage or clotting. Dr. Anwer uses real-time imaging and strict sterile techniques to minimize these risks. Why choose Dr. Bilal Anwer at the Leg Pain Clinic? Dr. Bilal Anwer is a board-certified interventional radiologist with years of experience in placing ports safely and comfortably, using minimally invasive techniques. At the Leg Pain Clinic, you'll benefit from expert care in a convenient outpatient setting, image-guided precision and low complication rates, same-day placement and discharge, a warm, compassionate team focused on your comfort.